NCLEX review. These are bite-sized videos, very small, short, to get your feet wet as you prepare for your NCLEX. First, read the last portion of the question. It will tell you what you're supposed to do. Which client should the nurse assign a team member to assess first? That means somebody should assess this patient. The charge name, the word first means prioritization. That means you have to prioritize and you have to be sharp. How do you be sharp? Think about breathing problem. Think about electrolyte issue, right? Think about shocking sepsis. Think about hypothermia, hypoglycemia. Think about airway. Think about neurological problem and think about pain. And this pain is not the one that is going to um basically just any pain, but pain that is you're going to lose your life, limb, and eyesight. So we're going to do that and see what it look like here. A charge nurse on the surgical ward received report on the following client who should the nurse assign a team member to go see, right? First, prioritization. The client who is post-op, who has a urine output of 20 ml. What? Every hour. For 6 hours, he's been peeing 20 ml every hour. Do you think this is expected or not? Or you got to be sharp. 12-hour post-op is reporting pain, 5 out of 10, at where the incision is. 2 days post-op, he has a fever, 100.4. And then 1 day post-op with the dressing change in a 30 minutes. Think about it. Prioritization 101. Which one is expected? And if it's expected, which one is more dangerous? Or which one is not expected? Most of them are expected finding routine care, like the last one. Dressing change is not emergency. Unless patient, there's no way it can become emergency, right? It's a routine procedure. It can wait. Post-op day 2, you have fever. It may be sepsis, but I did not give you anything that tell you patient is sepsis. Just a fever alone is not enough. They have to be associated symptoms to tell you this patient is in trouble. 2, 12-hour post-op pain from incision. If I cut you, you're going to have pain there. 5 out of 10, we have time to wait. 6-hour post-op, and it's been peeing 20 ml per hour. Dehydration. That's your right answer. As you can see, it's prioritization 101. So number 1 is the right answer. Next question. Which client should the nurse prioritize? Same thing. The charge nurse on pediatric unit is assigning care for the following client. Which one should you prioritize? You are assigning care. Which one should be given to somebody to see very quickly? 3-year-old with a temperature of 101.1 and mild diarrhea. You have diarrhea and you have fever. Gastritis, maybe sepsis, I don't know, but that's what we have, fever and diarrhea. Okay, put it together. Some infection, something going on, gastritis or C. diff, I don't know, but that's what we're given. 5-year-old with asthma exacerbation, saturation 92. Is having asthma exacerbation, that's bad. But look at the saturation, 92. 6 months old with the new rash after starting amoxicillin for otitis media. That means you have a ear infection and all of a sudden it's a rash. This allergic reaction. Type 1 diabetes, whose blood glucose is 140 before breakfast. I said be sharp, not expected. Expected finding number 4. If you have diabetes, your glucose is 140 before you eat, fine. We'll give you insulin. But if you take amoxicillin, you have a rash, well, I'm worried you may have allergic reaction. I got to see you because if I don't do anything, it will turn into an anaphylactic reaction and you may have airway compromise. Asthma patient, saturation is okay, even though that one can become a airway. But saturation do fine. 6-3 is in trouble. New rash, we got to make sure it's not getting compromised. Temperature 101, mild diarrhea. You have diarrhea, it may be infectious diarrhea. That's why your temperature is high. So the right answer is number 3. We got to deal with the rash first. Which client should the nurse prioritize? The charge nurse is in emergency department must assign staff to assess the following client. Which client should the nurse prioritize? Who should be prioritized to be assessed first? Client with suspected wrist fracture, reporting 7 out of 10 pain. If you have fracture to your wrist, the bone is going to hurt. If you have 7 out of 10, you're not dying. I'm talking about pain that you lose your limb, life, and eyesight. You have pain due to fracture, you're not going to die. A client with a head injury who is confused and a Glasgow coma score of 13. Head injury, GCS of 13, that's bad, TPI. Unless there's anything better than this, then that's your answer. A client with ankle sprain reporting difficulty ambulating. If you sprain your ankle, you're not going to walk. A client with chest pain will report no relief after nitroglycerine. That means MI. You have a heart attack, you have a heart attack, you have a heart attack. Therefore, I will take it over to who is confused and have GCS. But one is having acute coronary syndrome. 4 is having acute coronary syndrome. We need to see number 4 first before number 2. Which client require immediate assessment? A charge nurse is in the labor and delivery unit receive a report on the following clients who need immediate assessment. A client in the second stage of labor with contraction every 5 minutes. A client in the first stage of labor with the blood pressure of 160/90. A client in the third stage of labor with mild perineal pain. A client in the early labor reporting leaking of clear fluid. Think about it. Bring your OB. Bring your content. Figure out what is going on. It's prioritization. Who need to be seen first? Not an expected finding. Number 4, you broke your memory. Well, we can check it and make sure you truly have a memory rupture. Number 3, third trimester, you have labor pain, a perineum pain, because the baby is pushing down your perineum, unexpected finding. A client in the first stage of labor with the blood pressure of 160/90, that's hypertension, right? And you're in labor, probably pre-eclampsia. We worry about it. Client in second stage of labor, you're contracting every 5 minutes, expected finding. Who do you see? Number 2, test taking strategy based on your content. Number 5, a charge nurse on the medical surgical floor received a shift report. Which clients require immediate assessment? So you get information. Who are you going to see? You see, the questions are straightforward, no ambiguity, straight as much as possible. If the NCLEX change the wording, this is the frame of the question they will give you. No matter what you do, they have to be a buzzword in the question frame that will tell you it's a prioritization, immediate, right? A client with heart failure whose weight increased by 2 pounds in 24 hours. I don't like that. Exacerbation of heart failure. Unless there's anything better than that, you have to know the numbers, right? 2 pounds in 24 hours is bad. A client with pneumonia reporting difficulty breathing and saturation. You see, he's having symptoms associated with the pneumonia with saturation 88. One, even though CHF as evidence of exacerbation because of 2 pound gain, there's no symptoms associated with it. So we can wait. 2 cannot wait. SAT is dropping from the pneumonia. A client with DVT receiving anticoagulation therapy and reporting mild calf pain. If you have DVT, you're going to have mild calf pain. But what is the problem? We're treating you with anticoagulation. Nothing to worry about. Client with urinary tract infection, what do I expect? You have a fever, 100 degrees. That is 100 degree Fahrenheit. That is okay. It's an expected finding. Take care of yourself and keep charging as always. As we continue with the last question, the right answer is number 2. A charge nurse on a psychiatry unit must prioritize clients. Which client should the nurse assign a team member to see first? Who is going to be seen? That's the same thing. Who is the prioritized patient? Client with schizophrenia who is pacing and appear agitated. Pacing and being agitated, it can turn into violence. You got to stop that. A client with depression who has not eaten in 24 hours. If you have depression, seek a cap. Your appetite goes down or go up. This guy has gone down. Expected finding. A client with bipolar disorder who is talking loudly but stable vital sign. What do you think? Bipolar patient is very talkative. An expected finding, right? An expected finding. But what is that? Vital is also stable. Generalized anxiety who's having difficulty sleeping. If you're anxious, all the concentration in your brain and everything will affect your sleep. Thank you for watching. Follow this series. This is prioritization. Good luck in your exams, and I hope you learn something.